Taphiophobia. Taphiophobia, stemming from the Greek words taphos, meaning grave or tomb, and phobos, meaning fear, encapsulates a deep-seated dread of being buried alive or of cemeteries. This fear may arise from a variety of sources, including cultural beliefs, religious upbringing, or personal experiences. Individuals afflicted with taphiophobia often experience intense anxiety or panic at the mere thought of premature burial, envisioning scenarios of confinement, darkness, and suffocation. This fear can significantly impact their daily lives, leading to avoidance of cemeteries, discussions of death, or any reminders of burial rituals. Monophobia. Monophobia, also known as autophobia or isolophobia, is characterized by an overwhelming fear of being alone or isolated. This fear extends beyond mere solitude to include a profound anxiety or panic when separated from others, even briefly. Individuals with monophobia may experience intense distress, palpitations, or avoidance behaviors in situations where they perceive themselves as being alone. This fear can stem from various factors such as past traumatic experiences, attachment issues, or underlying mental health conditions, leading to social withdrawal and a reluctance to engage in solitary activities. Oxyphobia. Oxyphobia, also referred to as sharpsophobia, encompasses an irrational fear of sharp objects such as needles, knives, or scissors. This fear can trigger intense anxiety, panic attacks, or avoidance behaviors in affected individuals. The fear of injury or harm associated with sharp objects may stem from past traumatic experiences, cultural influences, or a predisposition to anxiety disorders. This phobia can significantly interfere with daily activities, leading individuals to avoid situations where sharp objects are present, impacting their ability to function effectively in various environments. Glenophobia. Glenophobia, derived from the Greek word glenos, meaning valley, denotes an irrational fear of narrow or confined spaces such as valleys or glens. This fear may be rooted in primal instincts related to survival and vulnerability in enclosed spaces, triggering feelings of panic or discomfort in affected individuals. Glenophobia can significantly impede an individual's ability to travel or participate in outdoor activities, leading to avoidance behaviors and social isolation. Therapeutic interventions such as exposure therapy and cognitive restructuring can help individuals confront and manage their fear, ultimately enhancing their quality of life. Claustrophobia. Claustrophobia is an anxiety disorder characterized by an irrational fear of enclosed spaces. Those with claustrophobia may experience intense panic or anxiety when in situations where escape may be difficult or impossible, such as crowded elevators, tunnels, or small rooms. The fear is often rooted in a fear of suffocation or being trapped without access to fresh air. Claustrophobia can significantly impact daily life, leading to avoidance behaviors and interfering with work, social, and travel activities. Treatment typically involves cognitive behavioral therapy, exposure therapy, and relaxation techniques to manage symptoms and reduce avoidance behaviors. Arachnophobia. Arachnophobia is one of the most common specific phobias, characterized by an intense and irrational fear of spiders or other arachnids. Individuals with arachnophobia may experience extreme anxiety, panic attacks, or physical symptoms like sweating, rapid heartbeat, and trembling when exposed to spiders or spider-related imagery. The fear may stem from evolutionary predispositions, cultural influences, or traumatic experiences involving spiders. Arachnophobia can lead to avoidance behaviors, impacting daily life and causing significant distress, especially in regions where encounters with spiders are common. Pedophobia. Pedophobia is a specific phobia characterized by an irrational fear of certain animals, often specific ones like dogs, cats, or birds. Individuals with pedophobia may experience intense anxiety, panic attacks, or avoidance behaviors when in the presence of the feared animals. The fear may stem from past traumatic experiences, cultural influences, or a predisposition to anxiety disorders. Pedophobia can significantly impact daily life, leading to avoidance of parks, neighborhoods, or social situations where encounters with animals are likely. Lachanophobia. Lachanophobia is an uncommon, specific phobia characterized by an irrational fear of vegetables. Individuals with lachanophobia may experience extreme anxiety, panic attacks, or disgust responses when exposed to vegetables or even the thought of consuming them. The fear may stem from sensory aversions, cultural influences, or past negative experiences with vegetables. Lachanophobia can impact dietary habits and overall health, leading to avoidance of nutritious foods essential for a balanced diet. Hyposophobia. Hyposophobia, also known as germophobia or mysophobia, is a specific phobia characterized by an irrational fear of illness or contracting a disease. Individuals with hyposophobia may engage in excessive hand-washing, avoidance of public spaces, or compulsive behaviors to reduce perceived contamination risks. The fear may stem from traumatic experiences, obsessive-compulsive tendencies, or cultural influences emphasizing cleanliness and hygiene. Hyposophobia can significantly impact daily life, leading to social isolation, occupational impairment, and decreased quality of life. Trypophobia. Trypophobia is an aversion or fear of clusters of small holes or bumps, often found in natural organisms like beehives, lotus pods, or certain plant seed heads. Individuals with trypophobia may experience intense anxiety, disgust, or panic when exposed to images or patterns containing these clusters. The fear may stem from evolutionary instincts related to identifying potential threats or from cultural influences. Trypophobia can lead to avoidance behaviors, impacting daily life and causing significant distress, especially in situations where exposure to triggering stimuli is unavoidable. Ophidiophobia. Ophidiophobia is a specific phobia characterized by an irrational fear of snakes, including both venomous and non-venomous species. Individuals with ophidiophobia may experience intense anxiety, panic attacks, or avoidance behaviors when confronted with snakes or snake-related stimuli. The fear may stem from evolutionary predispositions, cultural influences, or traumatic experiences involving snakes. Ophidiophobia can significantly impact daily life, leading to avoidance of outdoor activities, parks, or regions where encounters with snakes are common. Isoprotophobia. Isoprotophobia, an uncommon specific phobia, is characterized by an irrational fear of mirrors or reflections. Individuals with isoprotophobia may experience intense anxiety, panic attacks, or avoidance behaviors when in the presence of mirrors or reflective surfaces. The fear may stem from superstitions, cultural beliefs, or past traumatic experiences involving mirrors. Isoprotophobia can significantly impact daily life, leading to avoidance of mirrors, social situations, or environments where reflections are prevalent. Treatment typically involves cognitive behavioral therapy, exposure therapy, and relaxation techniques to manage symptoms and reduce avoidance behaviors.